Well, hi everyone and welcome. My name is Alma Cosme and I am the Vice President of Marketing here at the Village at Incarnate Word. We are a full service senior living community specializing in independent living. We have 3 levels of assisted living care, full nursing care, and today we are here to talk about our ministry, which is called Sisters Care at the Village, which is our in-home care program. And here with us, we have Frances Jackson. She is our operations manager here with Sisters Care at the Village. And we will welcome questions at the end of our presentation and our discussion today. So Frances, please introduce yourself.
Hi, I am Frances Jackson. I am the administrator for Sisters Care at the Village. I have worked in home care in San Antonio for about 12 years, and I've been with Sisters Care a little over a year now.
That's great. Frances is a wealth of information and we always go to her when we have questions, and we're so glad that you are joining us today. We often get questions about in-home care. What's the difference between home health and personal assistant services? So Frances, can you help explain that?
Of course, that is one of the most frequently asked questions about the difference between personal assistance and home health. So home health is going to be more medical. Usually a doctor will prescribe it to someone, or there is an actual medical need like physical therapy, occupational therapy, speech therapy, and they will provide bath aids, nursing aids, but it will be for a shorter amount of time. So for example, they might prescribe twice a week for 12 weeks, and that's what you get, and insurance will cover it. With personal assistance services, we are private pay, so the client signs up and then they decide what they would like. So it's usually non-medical home care, so things like bathing, dressing, incontinence care, dementia intervention, as well as our companionship services.
Okay, so I know that a lot of our caregivers are very experienced. And so I'd like to think that Sisters Care at the Village, because it originally was a ministry of the Incarnate Word Sisters, is just a bit different than other personal assistant service programs in that we also cater to someone's spirituality, and we can help with companionship. We also can drive someone to appointments. There's such a great need when you have an older person going to a medical appointment, just signing in, just, with COVID now and just trying to get into the building. We have an assistant that can accompany that resident to the appointment, stay throughout the appointment, take notes for our family members, and then drive that person back home. So can you talk a little bit about the spirituality, Frances, and how we cater to our clients?
Yes, and I'm so glad that you mentioned the tenure, because one of the most amazing things about Sisters Care at the Village is we have caregivers that are celebrating their 30th anniversary working with Sisters Care in the Village. And let me tell you, that's just unheard of in home care. There's usually a average industry turnaround of about 2 years with caregivers. So the fact that we have employees that have been here 30 plus years is truly astounding. And I would also think with COVID and the implications of companionship, loneliness, and walking on that spiritual journey, that has just been such a comfort to so many of our clients to know that they have a caregiver who can safely be with them. Many of them they have a difficult time seeing, so they do need assistance reading the Bible, conversing, even something as simple as streaming church on TV or Facebook Live, right? That's something that we might think is really easy and common, but for some of our elderly clients, it's just a little more difficult.
That's true. That's very true. And thank you for mentioning that. We do stream a Mass live from the Village at Incarnate Word every Friday. So we welcome everyone to join us for that. And another thing that I really like about Sisters Care is that you always offer that personal service when it comes to finding the right caregiver and connecting the caregiver with the client and the family. So the families have the opportunity to interview 2 or 3 people. It's very important to find the right mix. We want the client to be successful in their home in all aspects. Can you tell us, Frances, how the caregivers are hired and what that process looks like?
Absolutely. So we, of course, have a rigorous hiring process. We are looking at skill, location, availability, and that personality, as you mentioned, is such a big factor, right? Because you might have a client who has dementia, and you can have 5 different caregivers who are all dementia skilled, trained, have worked with dementia specific clients
Mhm.
for 20 plus years. But that personality is going to make such a difference, because when someone is with you in your home environment, quite frankly, you have to like who's there, right? So that skill can only take you so far. So we find that that personal touch makes such a big difference for our clients and residents.
I agree. So, in regards to training, can you tell us what that training process is?
Sure. So we have many caregivers and CNAs that come to us with a CNA license, or we also look at the amount of time that they've worked. We do require 1 year of experience. And then in-house, we have online training. We also have a nurse that works in-house at Sisters Care. And so as needed for clients, we also do person-to-person training and make sure our caregivers are specifically trained for that client.
Good, good. Well, thank you for that information. And um, we will also want to know, in terms of helping the family, can you tell us the kinds of things that the caregiver helps the family members with?
Sure, that is a huge one, because as much as we're there for the client, we can also be there to assist the family. So we have many clients that will utilize our caregiver to do the grocery shopping, assist their loved one with doctor's appointments, and take those notes like you mentioned before. And a huge one, which people sometimes forget, is sleeping. So if you have someone who needs personal care at night,
Mm-hmm.
how are you going to go to work, be refreshed, do your job all day at work, and then go home and also caregive for your loved one?
Mm-hmm.
So we have many clients that will hire us for overnight care just so they can get some much needed sleep, and then their loved one is still getting the attention they deserve.
That's great. I'm glad you mentioned that, because people often ask me, is there a limit, or does the schedule look like? Do they have to be booked for a certain number of hours? Is it once a week? Is it 24-hour care? Can you talk about the scheduling, Francis?
Sure. So with Sisters Care, we have 24/7 care all throughout the Bexar County area. And for us, we do sign clients up and allow them to use services as needed. Most of our clients, however, prefer to set up a steady schedule, simply because then they're able to bond with their caregiver, and it's just easier for everyone. So we do have a 4-hour shift minimum, but otherwise our client and their needs really dictate the hours that we work with them.
That's great. And I know your program is very flexible, so it could be once a week or it could be every day.
Absolutely. We have some clients that utilize us for that 24/7 care. And we have clients that use us once a month when they have some errands that they need assistance with. And as long as the client is happy with the schedule they're receiving, then we're happy they're getting what they need.
And I think this year we have seen an increase in some of our caregivers going out to do some shopping. So in order to
Yes.
keep the clients safe at home, our caregivers, who are thoroughly trained with infection control processes, went out and did shopping for our clients in their home. So that was very important with this past year and our COVID situation that we all are dealing with. So
Absolutely.
we're
Two
very
years
thankful for.
ago, I think everyone really focused in on the personal care needs, because of course that is a heavy hitter. But during COVID, we really saw that need for companionship, transportation, and the grocery shopping, doctor's appointments. It was just very difficult for our clients to get those needs met. So a
Yes.
caregiver was really instrumental in keeping them safe
Mhm.
and isolating as needed, while
Mhm.
also getting the supplies and companionship needed.
Yes, good. Francis, can you tell us about some of the things that the caregivers do not do or are not permitted to do?
Sure. So once again, home care is non-medical services. So they can't fill pill boxes. They can't diagnose. So while we might think there could be an issue, really all we do is we report to the family what we see, and then we let medical professionals take over at that point.
Yes. And I know because you have been in the industry a long time, you have a wealth of resources available to you, and you help connect families with those resources. So
Of
not
course.
only are you providing our personal assistant services and the companionship at home, but you're often a resource for our family members. And that's so important because there's so many opportunities out there, whether it's equipment that a client might need, home modification, that there's a big need for that, and making sure our clients are safe. The emergency pendant, we work with ADT within the village at Incarnate Word, and they have extended that service out to our clients in the community. So our clients receive a discount for that emergency pendant. And then a nurse to come in and set up the medication. You have a great resource for that as well. And then
Yeah.
our caregiver can carry out reminding the client about it's the timing of taking their medication. So just a wealth of information and resources for our family members.
Absolutely. And there is a lot to consider when you're finding these services and placements for your loved ones. So it's always nice to be able to offer our families a referral or a helping hand, since it can be kind of overwhelming. We love helping them figure out what we can assist with.
Thank
It's
you.
just a quick phone call.
Yes, yes. And so Francis, tell us about how much this type of service costs and how someone can pay for that.
Sure. So home care is private pay for the most part. Long-term care insurance, if you have it, sometimes they do have clauses for home care. Otherwise, in San Antonio, rates average between $21 to $24 an hour, just based on, again, that location or skill level needed. Since San Antonio is so big, it just kind of depends on where you live as to what the price would mean.
Yes. And how about couples, Francis? Is there a discounted rate that you offer for couples in the home?
Yes, that is another frequently asked question that we get. So if we have our primary client who has the most need and will need the most attention, they will be at the normal rate. So let's say $21 an hour. Then if their spouse is needing some assistance as well, we discount their rate by 50% as long as it's safe to assist both of them. Very rarely do we find that we will have to separate rates and give each a full rate.
Okay. And if someone has 24-hour care, is there a reduced rate for that?
Yes, there can be a reduced rate. Again, it just depends on that skill level needed. So if possible, we do give a $1 discount.
Oh, good, good. And so here at the Village, Francis, since we are a community that specializes in serving our clients and our residents who live here, and of course each other as coworkers, if someone is not able to afford that $21 an hour, is there help?
There is. So we have a unique program called Project Elder Help, and it is a sliding scale program. So there is an application that either our potential client or family member would fill out. Then we have a committee that will review applications and hopefully give that client the sliding scale price. And the great thing about that is we have wonderful clients who desperately need home care. And without that donation-based program, they would not be able to receive home care services. And we have clients on Project Elder Help that have been with us for a few years. And it's just a joy to see that we're able to help them.
That's great. That's great. One of the benefits of living here at the Village at Incarnate Word is being able to utilize Sisters Care services within our community. And some people are surprised to learn that you can bring help into your independent living apartment or assisted living or full nursing care area to supplement the help that is already in place. And so for our independent living residents, can you talk about the options that they have with Sisters Care?
Absolutely. So for home care, our idea of home is wherever our client is. So that could be a physical house, it could be a community setting, or it could be a hospital stay. We go where our client is. So specifically for our clients here at the Village, we have a concierge service where we can do 15-minute peace of mind visits, which bring great joy to our independent living clients. And then Sisters Care itself will do 1-hour visits for anyone throughout the village. So, and it's the same thing where we have clients here that use us once a week as needed or daily with those 1-hour shifts.
Yes, I know that that program has helped a good number of our residents, and sometimes you need help for a short period of time. Maybe someone has had a planned surgery, cataract surgery, or maybe a knee replacement and comes back home to the apartment. And Sisters Care has really been able to offer that support within the apartment temporarily. There's no long-term commitment. The scheduling is very flexible. Frances and her team are always readily available and do a great job. They're available after hours and on the weekends, and we just appreciate your service, Frances.
Oh, thank you. We definitely understand that sometimes plans go awry and a simple surgery can sometimes change into something more complex. And we really try to be there for our residents to make sure they're safe and they are comfortable and just have everything that they need. So we try our best to be as prompt as possible and get them those scheduled services.
We appreciate that. I know our residents and family members appreciate that. And so at the beginning of the program, we asked if and invited you to ask questions. Behind the scenes, as always, Maria Reyna, our Director of Market Development, is helping us with those questions. Maria, do we have any questions from our viewers today?
So we haven't gotten them up on Facebook. I'm getting a direct message to the village account. And we did have, someone wants to know exactly what the assessment looks like. What is when they call into the village, this is what I'm assuming they're asking, they call into Sisters Care and they would like to talk to somebody about their family and schedule an assessment. Frances, can you explain what that process looks like a little bit?
Absolutely. So we will take some information online and that just, or over the phone or online sometimes. Email is quite popular. And really it's fact finding. So we're hearing what the family might need and kind of already mentally thinking about how we would schedule it and the availability of our staff. Then either our client coordinator or myself or our alternate administrator would go in person to do an in-person assessment. And that is just so important because sometimes what the client may need or what the family might need is difficult to explain over the phone. So when you can see in person how someone is ambulating, or if they do need a hands-on assist for a transfer, you're able to paint that picture for the caregiver that you're going to assign with that client. And usually our assessments are about an hour. It really just depends on how many questions the client or the family have. And once we have that assessment, we start as they're ready. So we have done assessments in the morning and started that evening. It can be that quick.
That's great. Thank you for addressing that turnaround time. I think that's so important, especially when we have family members calling and there's such an anxiousness about the situation. And so I'm glad that you're able to relieve their anxiety and address that and have a caregiver in place right away.
Sure. In home care, it's one of those things where sometimes you don't realize you need assistance until you need assistance. So time is really of the essence. I don't think anyone really plans, oh, in 3 months, I think I would like, 10 to 2 shifts, 5 days a week. Usually when you find out you need home care, you're gonna need services pretty promptly.
Yes.
We did have one more question asking about contracts or agreements. Are they locked into a certain amount of time when they sign on with Sisters Care?
Oh, that is such a great question. So if a client ever wants to cancel services with us, they are agreements, not contracts. So we do ask for 24 hours notice, and that's either for a shift or for services in general, and they can cancel. If it is less than 24 hours notice, we do charge the full shift. That way we can pay our caregiver since they are scheduled for that day. But usually most people find that with the flexibility of being able to cancel their either shift or just services in general with a 24-hour notice, it just gives them peace of mind since they don't have to worry about, oh goodness, I have to give a 30-day notice or I have to mark on my calendar this day. Again, it's just about being flexible for our clients and their families.
Good. Any other questions, Maria?
The last one I have is, you mentioned after hours. What does that mean? So I think Alma mentioned there was an after hours phone number and you're available. Do you want to, I guess, explain more on that?
Sure. So when you call Sisters Care after hours, you are talking to someone from our staff after hours. So this is not an outsourced call. So if you have an emergency, somebody from Sisters Care in San Antonio, Texas is going to help you. And that is usually either if a caregiver has an emergency and has to call in for a shift, and that way our scheduler can promptly send a replacement. Or if our client has an emergency, our caregiver is able to contact our on-call manager, and then we're able to contact family, EMS, alternate services that they are partnered with as needed. And same thing, if you find on a Saturday afternoon that your loved one needs home care, all you have to do is call that on-call number and someone will call you back within the hour to set up an assessment and services.
So Francis, your staff is in office Monday through Friday,
We are
8 a.m. to 5 p.m.
We're Monday through Friday, 9 to 5, but again, we have that handy on-call number, so we're never too far away.
Yes. And so if you'd like information about Sisters Care at the Village, and by the way, the Sisters Care at the Village employees are employees of the Village at Incarnate Word. So it's not a separate entity. It is a ministry of the Village at Incarnate Word. So all employees are screened. We conduct a background check. If someone is a nurse aide, we check with the nurse aide registry to be sure that there are not any concerns that were filed against that person. If there were, we wouldn't hire them. If someone is a licensed nurse, and we have had licensed nurses on staff, then we check with the licensure board as well. So our phone number for Sisters Care at the Village is 210-733-9800. And if you'd like information about living arrangements here at the Village at Incarnate Word, my name again is Alma Cosme, and our phone number is 210-829-7561. You can find more information on our website, which is www.thevillageiw.org. And we want to thank Frances Jackson again for joining us and answering all those questions. She's always available, a wealth of information. And
Thank you for having me.
Of course. And we hope you have a great afternoon. Tune in again for future presentations. We are so thankful for you joining us today. Have a great afternoon.